I will get us started then. Thank you all for coming tonight. This must be a really important topic, huh? Yeah. Tonight we have Gerald Lodge, who's the Community Development Representative for Tufts Health Plan Medicare Preferred. He spent over 30 years working in the Medicare health plan industry, 28 years of those with Tufts. Gerald educates thousands of people each year on the complexities of Medicare and helps them understand the health plan options available. Tonight he'll talk to us about how and when to apply for Medicare, what Medicare Part A and B covers, and the various options with Medicare, Medicare Advantage Part C, Part D, prescriptions, and supplements. Thank you so much for coming tonight.
That was the most exciting part of the evening, by the way. All right, so thank you very much. All right, so yes, we're going to talk about when you need Medicare, how you get it. So we'll give you like a roadmap. At the end of the day, what are you getting with Medicare A and B? And then we'll go over the other options that you have available with Medicare. For those of you that have come here tonight that are eligible for retiree benefits from a company, the GIC, municipality that you work for, what I'm telling you is relevant, but the options that you get from your employer may be a little bit different because employers can change things a little bit, okay? So, please feel free to write on the copies of the presentations you have and take them with you. So, and one quick thing. When I talk about Medicare, I'm talking, original Medicare, I'm talking A and B. So when you need Medicare, A and B. So think of this slide. This is relevant if you are turning 65 and you need Medicare A and B. You're not working, maybe you're turning 65 and your group insurance isn't very good. In other words, you need Medicare A and B. This slide is relevant if you want it at 65. So you can start your quest for Medicare up to 3 months before your birthday. And let's understand the Medicare is effective the first day of the month of your birthday. Unless your birthday is the first of the month, then it's the first of the preceding month. So if your birthday's December the 23rd, Medicare, December the 1st. Right, so now you've got a line in the sand. You can start your quest up to 3 months before that. Now, if someone came in here tonight and said, well, actually, I'm looking to get Medicare October the 1st. Okay, you've got 3 weeks, thereabouts, it is what it is. I've had people do it in a week and a half. If you have 3 months, use it, all right? Now, you've also got the month of your birthday and then another 3 months after that. This is your initial enrollment period when you can sign up for A and B at 65. Right-hand side is going to show you how to do it. Now, there's a lot of people that when they turn 65, they're already collecting Social Security. Those people are going to be quite pleasantly surprised to find they're already going to get the Medicare card in the mail. Up to 3 months ahead of time, there it is, A and B. Because the idea is that Social Security can take any premium out of your Social Security check. So they send you the Medicare card, A and B, up to 3 months ahead of time, big mountain, flattened. Now, on the other hand, if you say, well, I'm not taking Social Security for another year or so. So, if you're not taking Social Security yet, then you have to have a conversation with Social Security about Medicare. Social Security is sitting there going, we don't know what they're up to. They haven't told us. So if you're not going to take Social Security, but you want Medicare A and B, then you've got to go on either to socialsecurity.gov, medicare.gov, or if you've got the time, make an appointment and go into Social Security directly. But you can go onto the website anytime, day or night. When you do socialsecurity.gov, You go to the home page, top right-hand side, it's going to say sign in, sign up. You sign up and set up an account with Social Security. You know, that's where you can go in and check how much Social Security you're going to get when you retire. But you can also use that to apply for Medicare. Okay, so if you're not collecting, you have to tell Social Security what you're doing. Questions on this slide? So,
if you get your card 3 months in advance, as it was advised, and you're going to go forward and like it is, when do you find out how much B is going to cost for monthly payments?
so when will you find out how much your B is going to cost? You'll get well, if you're taking Social Security, then you'll get a statement from Social Security that will say, as of such and such a date, you'll get X amount, of which the Medicare Part B will be so many dollars.
That happens on the birthday month.
You'll get that beforehand. You'll get that beforehand. Yes, miss?
Yeah, so, Part B, do they enroll you in a particular health plan?
No.
Do
So,
they give you options to pick the health plan you want?
I'll tell you about that in about 3 slides' time.
Okay.
Over there.
So is age 65 the most typical age that you start taking Social Security?
Well, no, as far as taking Social Security, the earliest most people can take it now is what, 66?
62.
Well, no, sorry. The full Social Security. Yeah, you can take it at 62 if you like, but full Social Security is generally 66 and a little bit more now.
So if it's 66, and then you have to contact, you said if you're not on Social Security at age 65, then you have to tell Medicare that.
You've got to.
Better to be on it.
You've got to have a little conversation with yourself. Everyone does. You've got to figure out, what are you going to do at 65 and 1 day? Are you still working? Are you covered by a spouse? Are you going to be retired? Do you collect Social Security or not? And the fact now that, you know, unless you're disabled under 65, Medicare for most people is going to, the first time they can apply for it is at 65. The trouble is now is that Social Security is moving further away. It would be nice if they were both moving along at the same speed, 65, 66, but it isn't. Medicare is 65, Social Security is 66. So you've got 2 different things you're doing.
So, but you are allowed to be on Medicare when you're 65 and not be on Social Security until you're later.
Correct.
You may have to make an appointment at the Social Security office.
At 65, if you're collecting Social, you're going to get the Medicare card automatically. If not, then you go online or you make an appointment, preferably up to 3 months before you need it to start.
Where are these offices? Are they local or?
You got Lowell, you got Haverhill, you got Malden, Cambridge.
Is there one in Woburn?
No, I think there's one in Waltham, though.
Okay, so
Yeah.
local is one.
Yeah. And one quick thing. Let's understand the relationship between Social Security and Medicare. I can have Medicare without Social Security. I can have Social Security without Medicare. The connection is that I apply for Medicare through Social Security, online or in person at my local office, and any payments for the Medicare are going to be collected by Social Security. All right, any other questions on this slide? Yes.
It says that you're automatically enrolled in Part B if you're on Social Security. But Part B is not mandatory.
That is correct, and I'll tell you a what if, if you keep working or whatever. I'll tell you that in a minute.
And just one question about doing it simultaneously. Signing up for Social Security, starting your 65th birthday month, and Medicare at the same time.
Mm-hmm.
Is there any advantage to that? Well, because if you sign up for Social Security beforehand, then they'll automatically do it and take it out of your Social Security.
Right.
But if you wait till, if I start doing this 3 months early and say, as of my 65th birthday, I want to start Medicare and start Social Security, will that complicate things or simplify things?
So if you start them both together,
Right. the same
so
amount,
bear in mind, if you take Social Security at 65,
full benefits, yeah.
well, you're going to get a little bit less, aren't you? Right. If that's all right with you, you know, that's down to yourself, isn't it? As far as, does it make life easier? Well, yeah, because you can do it all in one go at socialsecurity.gov up to 3 months ahead of time without leaving your house. You can do it on the computer.
Okay.
Question at the back.
Yeah, it was my understanding that if you didn't sign up for Medicare in that 7-month window, then you were financially penalized for life.
That is the next slide. At the back.
Could you actually back up and say what Medicare A, B, C, D are?
4 slides time. 2 more questions and we're going to move on. One here.
I'm going to be 62 in November. Do I do anything, or I'm looking at a new job right now that I might do full time? Either alone and
So if we're 62 and we're starting a new job, obviously you can collect Social Security if you like. Obviously it's a lesser amount, that's up to you. But Medicare, for someone under 65, the only way someone under 65 can get Medicare is if they've earned it due to a disability. One question over here. This gentleman.
My understanding that if you keep working after 65, you still have to sign up for this at 65.
Your understanding might be a little bit different on the next slide. Let's move on because I think some of these questions will be answered in a minute. Now, look at the top. This is for someone who is taking Medicare at 65. Now, someone is going to say, well, I think I might continue to work. I like my job. So, a couple of scenarios. Let's say you're going to work past the age of 65 and you've done a little bit of research, your company will continue to cover you and your group insurance is good, it's affordable. In other words, you would like to stay on your group insurance with your company or your spouse's company. Now, first scenario, let's say you're already collecting Social Security for whatever reason. And so Social Security goes and sends you that Medicare A and B card. And you go, well, I'm working, I've got group insurance, I don't really need Medicare A and B right now, and I don't need to be paying for it. So what Medicare would invite you to do, if you didn't need it, is to sign the back and send it back to Medicare. At which point, they will send you another Medicare card with only Part A on it. So Part A is free, and the instructions will be, please don't use this, please don't show it to anyone, carry on with your group insurance as if it never existed. Now, so that's one scenario. I'm collecting Social at 65, but I'm going to continue working with my group insurance, therefore I don't need A and B. So let's do the other scenario. I'm coming up to 65. I'm going to keep working, and I'm not going to take Social Security. All right? Now, so then, you know, again, we look, group insurance, good, affordable, great, because no one says, just because the company offers you insurance, no one says you're mandatory, you know, you don't have to take it. If you want to keep working and find it's cheaper to take Medicare and something else, you can do so. Now, so I'm going to keep working past the age of 65. The correct thing to do again is to go to socialsecurity.gov, set up an account, and tell Social Security, I don't need Social Security and I don't need Medicare because I'm still working. And they'll still send you a Medicare card, but with Part A on it only. And again, with the instructions, you know, don't use it, carry on with your group insurance. And it's their way of putting you in the system, and by acknowledging that, they're sending you out the Part A card, it's free, don't use it, carry on with your group insurance as if it never existed. Okay? Now, then we hear all this business, well, if I don't take Medicare at 65, I'm going to have a penalty and all those terrible things that you hear. So, that's this slide. So if you're going to work past the age of 65, well, you're covered by a spouse. And eventually, you're going to retire. This is the slide that's relevant. So now, you got Part A, you've done the right thing, you got Part A, you're using your group insurance, now you're going to retire, you need to apply for Part B. So again, you can apply for Part B up to 3 months before you need it to start. Again, when's it going to start? The first day of the month. So if you're retiring halfway through the month, one of the questions you're going to ask your HR people is, are you going to cover me until the end of the month? That way you know whether the Medicare is going to start the first of the preceding month or the first of the following month. So, you can apply for the Part B up to 3 months before you need it to start. If, for whatever reason, covering a younger spouse or whatever, if you decide to take COBRA, whereby you continue with your group insurance, but you're paying the full premium, if you decide to do that, do not do it for more than 8 months after you're eligible for Medicare. All right? I'll talk about that a bit more in a minute. So, I'm over 65. I'm going to retire. I can apply for Part B up to 3 months before I'm going to retire. Again, if it's 3 weeks, it is what it is. Right-hand side, this is how you're going to do it. Because now we hear all of this business about penalties. There's 2 forms. CMS L564, CMS 40B. You go to your, whatever your search engine is, Google or whatever it is, just put that in. CMS L564. One of the first 5 or 6 things to come up will be the PDF of that official form printed out. I have life-size copies here, and I'll pass these around. So the L564 is called Request for Employment Information. Your company is filling out part of the form. The form itself is 1 page, there's about 2 pages of instructions. Your company, your employer is filling out part of that form showing your dates of coverage, showing that, hopefully that you've had continuous coverage since you were first eligible for Medicare at 65. This is the form, the top one, is the one that's going to stop any potential penalties by showing that you've had continuous group insurance. Now, if you've had more than 1 job with more than 1 insurance since 65, you're going to need it for each insurance company. Okay, again, Social Security is looking to see that you've had continuous coverage all the way through. The other form, CMS 40B, is the application for Part B itself. It's half a page, it's 30 seconds to do. It's really easy. Again, if you work for a larger company, they'll have the top form on file. They'll be ready to fill that out. Those are the forms that are going to stop you getting this Part B penalty that you hear of. So with those, you're going to go in person to your local Social Security office. If you are able to plan out when you're going to retire and you have this 3 months, if you want to, give them a phone call. Set up an appointment so you don't have to wait. Other than that, go in person. Personally, do not let your employer mail the information in. Do not mail it in yourself. Do not go there and just drop it off. You want to speak to someone. You want to make sure that everything's been filled out correctly. You want to make sure your questions are answered. Okay? And then from there, you should have a Medicare card with Part B on it in about 30 plus days. I am able to go into the Medicare system if anyone needs to check a little bit sooner. If time is of an essence, I can certainly do that for you. So, over 65, the forms stop that penalty, and you can apply up to 3 months beforehand. If someone, for example, turns 65 and continued to work and said, I'm not taking Social Security, I don't need Medicare, and that person does not have a conversation with Social Security. So Social Security is sitting there going, no, they haven't told us, we don't know. And you'll get this every now and then where someone is, I'm 67 or whatever, and I don't have either part of Medicare because they never had a conversation. All it means is that when you fill out these 2 forms, your visit is going to be a little bit longer Because you're not already in the system. Okay, the correct thing to do is to let them know. They send you out the Part A card, you keep it at home, you don't use it, and you carry on. All right, questions on this slide? Oh, yes, sir.
If you've let it go more than 3 months after turning 65, under this scenario, and you let them know, they'll still send you the card, there's no penalty for the Part A piece to that, or is there?
There's no penalty for the Part A. So if you're working past 65 and you forgot to tell them, yeah, go online and let them know, and they'll send you out the Part A card. Yeah, yeah. And that's free, by the way, yes.
So right now, I get my coverage through the Commonwealth Care, I think it is, after they keep changing the names. Anyway, when I turn 65, assuming that I remain eligible each year, do they just boot me off when I'm 65 and I automatically go to Medicare?
You're collecting Social Security?
No, I'm not collecting Social Security. I'm just on the state's.
Okay, so the state plan there, you would generally expect, and again, call them up directly, you would expect that to stop at 65 because they would expect, if you're able to, or you're eligible, to take Medicare A and B. And then you would reapply to see if you're eligible for the equivalent type of plan over 65.
So the bottom line is even though I'm getting health care now from the state, free, it may end when I'm 65. I have to go to the Social Security office and discuss it with them.
Even though you're getting a state-assisted program right now. Right. That's based on income limits for people under 65. Those income limits change when you get to 65, so you can't assume that it's automatically going to roll over. No. You may qualify for a different program better, or maybe none at all. But they would expect you to get Medicare and then take it from there. They would, yeah. Yes, miss.
I might have missed it, but what's the difference between Part A and B?
You haven't missed it yet. Is in 2 slides time.
Okay.
2 slides time. I've
Okay.
yeah.
So why is it if I'm going to retire at 70 and I don't tell them, and at 70 I go in and say, I'm retiring, they're gonna penalize me because I didn't tell them at 65?
No. That's no. That's right. So what didn't you tell someone at 65 that you were going to continue to work, and what didn't you tell them?
I just keep working, right?
Did you have any conversation with Social Security? Right, so that's what I just said. The fact that if you work past 65 and you don't have a conversation with Social Security, as long as you've got group insurance that's as good as, if not better than, you fill out these 2 forms, and it just means that you've got a longer time to spend with Social Security because they've got to put all of your information in. They haven't got anything in. No, that stops the penalty. Yeah. At the back.
Quick clarification. 66, I started taking my full social benefit, signed up for Part A online. I'm not going to retire at Part B. Did you mention that it had to be in person? These forms get sent in. I can't do Part B follow-up enrollment online?
If you're over 65 and you've got Part A and you're going to go apply for Part B, that's when we talk about this penalty. That's when you've got to get those forms filled out. That's when they have to go directly. You can't do it online. You've got to go directly. Just print it out and, yeah. So.
The gentleman in the front was asking if he can, wait till 70 to go apply to Social Security. Can you also go at 65 and fill out that form and then wait till 70 to retire? No, the Medicaid part. Just let them know that you're around at 65. Keep working until 70 and then.
Well, you can tell Social Security, this is me. I'm still working, don't need Social Security.
At 65.
At 65.
They'll send me the card.
And then I'll send you the Part A card, which is free. Keep it in the background, don't use it. Half the time you forget you got it.
Now when the time comes to retire, I'm ready to go. I don't have to fill out the
You do have to fill out those.
form, I just have to fill out the
You have to fill out both of those. Because Social Security is going to say, thanks for letting us know what you were up to at 65, but we don't know what's been happening from 65 to 70. And you're going to go, well, blah, then you're going to say, fill out the forms.
The penalty only kicks in if on that form L564, you showed no insurance for a period of time, right?
if someone retired at 65 and said, I don't see a doctor, I'm not going to pay for Medicare Part B, I take herbs or whatever. Or let's say someone's working past the age of 65 and the group insurance is not as good as, if not better than, Medicare. Let's say it's really bad. That's when they're going to assess your penalty. You come across it, a couple of times a year. Really, you do. Really, you do. One more question on this slide. Yes, sir.
Wait. The very first quote, past the age of 65, is that what you do, like 1 day? Is there any, it's like 4 days food a month if you turn 65?
Well, there's if I'm taking it at 65, I've got a 7-month window around my birthday.
Right.
If I don't do it within that 7-month window, maybe I'm working past 65 or covered by a spouse, and there we go. Now, if you don't take Part B when it's initially offered, i.e. when you do retire, or you take COBRA for more than 8 months, this is going to be the scenario that is going to greet you by Social Security. Again, I've done it. I mean, I've come across this maybe once in the past 5 years. You would come across this if you're, perhaps, I'll give you a scenario. Let's say you're working, covering a spouse who's younger than you, and you retire. And instead of taking Medicare, but let's say you're eligible for Medicare, instead of taking Medicare, you say to your spouse, tell you what, I'll take COBRA so that you will have coverage and we'll get you up to 65 and you can go get Medicare and everything will be fine. So if you're taking your spouse into account and you're saying, we'll take COBRA so you've got continuous insurance, etc., etc. If you were to do that and therefore not take Medicare yourself, if you stay on that COBRA, if you're eligible for Medicare and you stay on COBRA for more than 8 months, this is the scenario that's going to greet you. I had this, oh good Lord, many years ago, maybe 8+ years ago now. Chap had done this, he'd covering his spouse, he took COBRA, she got up to 65, got off, got Tufts. He, in October, then went into Social Security and said, can I have Part B now? And because he'd had COBRA for more than 8 months, they said, well, can you come back between January the 1st and March the 31st? The Medicare isn't going to start, the Part B isn't going to start until July the 1st, and you're going to have a 10% penalty for the rest of your life. And it was a very rude awakening, and I went through the connector, the individual Tufts plans, and anything and everything. And everyone said, no, he's got Part A. That's insurance. And so he had nothing but Part A, hospital insurance, until July the 1st. So, COBRA, if you're taking it to cover a spouse that's under 65, coming up to 65, don't do it for more than 8 months. How many months? 8. Good job. Right, I'm going to start drinking. So, I think we can all right, I'll take it.
If you're doing private insurance, is that the same thing then as the COBRA case?
Can you say that again, please?
If you're not covered by an employer or anybody, so it's being private for your insurance, is that really the COBRA case?
It's like if someone's self-employed. If someone's self-employed and they're paying for their own insurance, those are the people that you generally find can't wait to turn 65, regardless of what they're going to do, because all of a sudden their insurance is just reduced dramatically. Yeah, if someone's self-employed, there's no reason I can really think of, not to take Medicare at 65, even if you're going to continue to work. All right. We've got you on Medicare A and B, 65 or later. We've got you on Medicare A and B. Now let's have a look at what you've actually got. All right. Two parts. You know, we call this original Medicare. Two parts. Hospital Part A, which is free for most people. Medical Part B, the optional one, which has a premium. Let's have a look at Part A. Let's break things down. If we used Medicare to pay our bills, Part A covers us for an inpatient hospital stay, skilled nursing and hospice. Part A says if you are admitted to the hospital, you have to pay the hospital the Part A deductible this year of $1,364. That is not per day. That is not per stay. Oh, what is it? It's per benefit period. I'm just telling you this, don't worry about it. All right, so Medicare says the benefit period starts the first day you go in the hospital. Doesn't matter if you're in there 1 night, 20 nights. Hospital is eventually going to send you a bill, $1,364. The benefit period resets once you've been out of a hospital for 60 consecutive days. So if I go into a hospital for whatever reason, for X amount of days, I'm going to get a bill for that. If I go back into any hospital for any reason within the 60 days, I only pay it once. If I'm out of the hospital for 60 days plus, and I go into another hospital for whatever reason, ka-ching, new benefit period, I have to pay that again. That's a really long way of saying you may be responsible for that more than once a year. Part A. Part B. That's the one that has a premium for most people. This year, most people are going to pay $135.50 a month. If you are taking Social Security already, it's automatically taken out of your Social Security check. But if you say, well, I'm taking Social Security at 66, but I'm taking Medicare at 65, then what's going to happen is if you're taking Medicare before Social Security will send you a bill in the mail for 3 months premium at a time until you do take Social Security. So they'll get you either way. All right, you're paying for it. Now, most people are paying $135.50. I don't have the specific chart on me because if I get it wrong, it's not good. But the Part B is based on your income as declared on your taxes 2 years past. And depending on your earnings, it can be up to $460 for exactly the same Part B. Let me get in. If your income's low enough, Part B can be paid for you. If you go to socialsecurity.gov or medicare.gov, there's a lovely little chart, single, married, income, it will show you. And again, it can catch you out. If you go into retirement and all of a sudden you get a windfall at the casino or something, or an inheritance, all of a sudden, boom, up goes the Part B, because they know it's the government, they know. So,
but it takes 2 years.
Well, yeah, so you'll have forgotten about it, but they won't, yeah. And so the point is, you're not showing any TurboTax, it's the government. They automatically know, and they automatically adjust it as your income comes down into retirement. So just take that into account. Now, and what happens also is, at the end of the year, if there is a cost of living increase, they giveth with one hand, they taketh with the other. That's when you'll see the $135.50 go up. Okay, now, Part B. Doctors, tests, outpatient services. All right. This year, there is an initial annual deductible of $185. So the first $185 of your Part B services, you're going to be responsible for. Then it's Part B that does the 80% of the reasonable charge. You're paying the 20% of the reasonable charge. So that it's all that much easier for you, what happens is every time Medicare processes a claim from a provider, they send you out a statement with a legend at the top, this is not a bill. And it will tell you, this is who you saw. This is the services, this is how much those services, the provider submitted for a bill. Next to that, it'll say, this is how much the provider has agreed to accept as payment in full. In Massachusetts, like most other states, the providers cannot balance bill. Then it will say this got put to the deductible, this got paid at 80%, and then the last column will let you know what you should expect for a bill from the provider. So Medicare lets you know. You don't have to keep ledgers. So for services that Medicare covers, which is pretty much what you need when you're not well, it could, you're either paying the hospital deductible, the medical deductible, or the 20%. Right-hand side. Let me get to the end, and then I'll take. So, right-hand side, you can see anyone in the country who accepts Medicare. Pretty much everyone does. Every now and then, someone will come along and say, but I hear they don't pay that much, so some providers don't take them. That's Mass Health, that's Medicaid. All right, so before anyone starts doing that, pretty much everyone accepts Medicare. No referrals, no networks, no ins and outs. Now, there is no maximum out of pocket. Most of you here that have got group insurance plans have a maximum out of pocket. In other words, once your expenses, deductibles and co-pays have reached a certain amount, your plan will generally take over and cover everything 100%. With Medicare, that doesn't exist. So you've got to be careful, because if, let's say you go in the hospital for 3 nights and you have surgery. Now, the hospital's going to send you the bill, $1,364. You're all right with that. But if you're seeing independent doctors in the hospitals, surgeons, anesthesiologists, that are not part of the hospital staff that come in and perform the surgery and then scoot away, they're sending in their bills under Part B. And so all of a sudden, there's all these other bills that come in that you weren't expecting. You've got to be careful. And again, there's no maximum out of pocket. Medicare does not cover you out of the country. The only exception is if you are in America, something happens and the nearest facility is across the border, Canada or Mexico, that's it. And this has nothing to do with Medicare Part D. I will tell you about that on the next slide.
You said something about balanced billing.
Balanced billing, yes.
What is that?
Well, all right, so it's like with any other insurance plan. You can send in a bill for whatever amount, I'm feeling hopeful, let's send it in for $1,000 for that 10-minute office visit. So in other words, a provider can send in a bill for whatever they like. But under the agreement with Medicare, they have agreed to accept X amount of dollars as payment in full for that service. Now, we're going to have Medicare do their little bit, deductible 80%, and you're going to be responsible for the balance up to what Medicare has allowed. And let's say the provider sends in a bill for $150. We're feeling lucky, it's the end of the month. And let's say Medicare says, no, we only allow $90 for that service. The provider cannot come after you for the $60. Okay?
So Part B, does that cover preventative care, like for most insurances now, you have to be covered 100% for annual physical, for mammograms, for any kind of preventative services, 100%.
Medicare, as far as wellness services, Medicare gives you or covers 100%, like everybody else, a welcome to Medicare physical when you first join. After that, Medicare covers a wellness exam every year. And that is where, it's in the Medicare book here. There's certain tests that should be done at a certain frequency every year, every 3 years or whatever. And so you, due to your age, would be given X amount of tests, and those will be repeated every year or every other year or whatever the case would be. It's based on your age, whereas a physical is based on your health, your family history. So with Medicare, they would cover all of those 100%, but you only get that initial welcome to Medicare physical once. And other than that, it's a wellness visit. Well, you know, again, they cover the standard test, but you might want something specific for yourself or, you know, due to your family history. Question over here.
On medical Part B, you said the premium can range from $135 to $460 based on income. Do they take husband and wife, or is it just the person?
It depends how you file. That's why I was going to say, if you're interested as to how they calculate this, go to socialsecurity.gov or medicare.gov, income-related Part B premium, and it will show you, because it will say if you're married filing individually, married filing joint, it will let you know what the income limits are.
Do you have any rough idea?
Oh, it's incredibly rough, and it's too rough to tell you. No, I don't know, because it's different. It's a grade. It doesn't go from 135 straight up to 460. There's different levels. If I tell you and I get it wrong, then that's not good. Someone over this side, yes sir. I'm sorry?
The Part B cost, is that reset every year based on what you prior to the year you income?
The income, does the income reset every year? Yes, it does, yes. Yes, sir.
Now, that you said about filing separately. Now, if you're on the COBRA with your spouse, and we come to the 8-month period where you say you file apply for Medicare B, do you apply as separates, or you have to apply as married?
That's a good question. So when we're on COBRA, when we're working, husband and wife, they're on the same plan. One is the subscriber, the other is the spouse. When we go and get Medicare A and B, everything is individual. So you're not this is your Medicare A and B, your spouse has their own Medicare A and B, and you all go out and get exactly what you want. There's no more family plan, 2-person plan, or anything like that.
So the reference I'm going to is income. How is the income figured? I've go individually, and one was already on Social Security, the other one was working, but one on COBRA, was still covering.
I'm going to go back on that and say it's whatever you declare on your taxes, however you do it. Go to the Medicare site and look at the chart. It will tell you. Yes, miss.
So will you know what your Part B premium is the day you go to Social Security and sign up for this? Will they tell you, okay, your premium is going to be $135 or it's going to be $250? You kind of know that, or are you going to get kind of surprised?
I would suggest you check what, figure out what your income is. And then 2 years go, and then go onto the website and have a look. Take your income, that's declared on taxes, go to the Medicare website, socialsecurity.gov, and put it in and see. Because in some instances, the premium can be zero. If someone's income is low enough, the Part B with assistance can be paid for you. And again, it will tell you what those incomes are.
Do they take income other than W-2 income into consideration, like interest, dividends?
Whatever's declared on taxes. I'm just going to keep saying that. Whatever declared on taxes. One more question.
So when, so if your status changes from married filing jointly and you're covered under your spouse's insurance, no one's collecting social, you got Medicare, and then you're single, so your income is, your filing very separate.
So what you're reporting is much lower.
Much lower. So then when does that get reset?
2 years, every 2 years.
It takes 2 years.
2 years. Every year they go back 2 years.
Every year they look at you.
So 2 years' time they'll go back to this year and they'll say, oh, she's single, so therefore income was reduced, as whatever the case may be.
So the premium won't change I got my first premium check a couple weeks ago. So that's not going to change now for 2 years.
unless your income changes.
Yeah.
Yeah.
They're going back 2 years.
Right? If your income for the past 2 years has just declined,
Are they gonna look at our joint marriage?
however you filed 2 years ago. However you filed 2 years ago. Question.
Just to amplify on that question, because I've had some experience on that. Also on the website, they talk about how you can apply for, let's say, forgiveness if more recently you've had a change in status. I think they call it a significant life event. Certainly a change in your status would count as that, which allows them to reset to your current income rather than something that was 2 years ago. And they describe that when they talk about, when they send you a letter telling you that they're applying the premium, they also point you to all the things you can do to apply for forgiveness or for
an appeal.
An appeal, right? And it's fairly straightforward. And if you've had a significant life event that is going to reduce your income significantly, they're more than willing to bring the premium down.
One last question, yes.
So July 1st is the premium year, right? The premiums begin on July 1st each rolling year, right?
January the 1st is when all of this will be subject to change. January the 1st.
January 1st, okay. So January 1st, 2019, they looked at the 2017 tax filing?
Yes.
Okay.
Yes.
I wanted a concrete example, numbers.
Now, I've showed you how to get it. I've showed you what you get. Now, most people look at Medicare A and B and say, okay, fair enough, I need prescription drug coverage. I'm going to go out of the country. I need something that gives me lower out-of-pocket costs and all this hospital deductible and everything like this. I want something that's a little bit more concrete than the 20%. And that's where we go out into the showroom and we pick up the phone and we go, yes, health plan, can you send me an envelope full of information, please? And at 65, you become everyone's friend and everyone's sending you all this information. And this whole thing of choosing another option becomes totally overwhelming. It's like, I just got Medicare. You can't make me go do this again. So I'm going to show you the showroom. It doesn't matter what company, it doesn't matter what state you would be in. If I've got Medicare A and B, put aside Mass Health or anything else, if I've got Medicare A and B, this is your showroom, and it helps if you have an idea of what you want. Most people, when you go up to them and go, well, do you want a health plan? They go, well, I don't know, you haven't told me what you got yet. You don't know what to expect as a fair premium. You don't, should I expect this? Can I ask for that? I always say, it's a good idea just to have put at the top, I want everything, but I don't want to pay for it. Right, get out the window, get it out the window. But then you go down and you say, oh look, I need something that will cover me if I go abroad. I need coverage for these particular medicines. I wear glasses, I want dental. I work out at a gym, I must keep my doctor. I want to go where I like. Write out what you want. What you want. I don't want to know about 5 years' time. Just figure out what you want for the rest of the year, because at the end of every year you can change. Talk about that in a minute. So have an idea of what you want. And then these options are going to make so much more sense. And I liken this to buying a car, equally a wonderful thing to do. You don't go into the showroom and say to the salesperson, tell me about all this lot in here, and then we'll go outside and you can tell me about these 200 out there. You have an idea, I want this colour, I want this many doors, I don't want to pay more than this every month. Talk to me. And you have an idea, whereas a lot of people say it's easier to buy a car than it is to do this. Figure out what you want. Be selfish, seriously. And again, if you've got a spouse, everything's individual. No one's compromising for the other person. Whether it be good or bad, these are the options, that's for you to decide. So the first option, at the top of the page, going across, is Medicare. And I'm going to tell you this now, and I will at least one person's going to ask this later. Yes, you must have Medicare A and B. You must keep it, and you keep it by paying for it. So if you want, I'm going to give you some rough figures here so we know what we're looking at, Ferraris or Priuses. So at the top of the page, $135.50 for your Medicare Part B, cast in stone. You've got to have it, you've got to pay for it. So take that into account before you go shopping. Left-hand column. If after all of this you say, that Medicare sounds brilliant. 80%, I thought it was 79%, it's 80%, brilliant. So if you say, all right, I'm going to have Medicare A and B for now for my doctors and hospitals, I'm all right with that, that's fine, you know, but I need this Part D prescription drug coverage, all right? So you're free to go out and purchase this, what they call a standalone Part D plan. Now let's understand a couple of things here. You don't phone up Medicare and say, can I have one of your Part D plans? Prescriptions, that's gonna be a very short conversation. The way it works is Medicare lays out the specification of the average Part D drug plan across the country. There is an average premium of this, there is a deductible, there's percentages, there's a formulary, and then there is this gap. And Medicare says, tell you what, private companies, you offer your version of that, and we, Medicare, will pay you every month for everyone you enroll. So all these private companies come along, some you've heard of, some you haven't, and they will have this premium, we'll have this deductible, we'll have this formulary. And Medicare pays those companies, those plans, for everyone they enroll. So you get Part D from private companies who are funded by Medicare. Now, some of you have seen this book. Some of you have attempted to read it. It's good, it's a good book, it's a good book. Point is, when you get this through the mail, it is specific to where you live. If you look at this online, it's generic. The point is, if you go to the back of this book, turn it sideways, go to the back of the book, and it says, here are all 26 standalone Part D drug plans for you to choose from in Massachusetts. Nothing like having a choice. Last year it was 23, and we go, that's a lot. This year, 26. Now, so the premiums range from $14 to $127. So that's a lot of plans with a big variance in premium. 8 minutes of your life would boil that lot down really quick. Go to Medicare.gov, the official Medicare website, Medicare.gov. 3 green buttons on the one on the left says something like choose medical and drug plans. Click on it. It's going to ask for your zip code. Then it's going to ask you some questions. It's going to say, do you have Medicare? Pretend. Age yourself. Yes, I do. And then it's going to say, well, do you get assistance? Well, you know, it's up to you, isn't it? And then it's going to say, would you like to enter your prescriptions now? Yes, please. And then it will say, go to the next page to enter your prescriptions. Quantity, strength, and it will remind you every now and then, did you know there's a generic? You know, so you enter all your medications, the strength, the quantity, everything like that. Next slide you go to is going to say, well, what pharmacy do you get these prescriptions from? Because Medicare understands that the 26 plans in here have negotiated different prices with the pharmacies. So they're not locking you in. This is, it's totally anonymous. So, and you can change the pharmacy. Well, we'll go to a different pharmacy, see if we get a different result. Excuse me. So you put your pharmacy in, and then you go to the results. Top results says Medicare and prescription drug plans. You click on it. And while it's doing that, just like that, what it's doing is it's giving you those 26 plans most cost effective first. So it's not saying the first one is got the best customer service and is the most wonderful plan or whatever. It's saying, based on your meds, where you live, premiums, deductibles, co-pays, the first one that comes up is the most cost effective for the rest of the year. And it will tell you, if you go to the pharmacy, it's going to cost you this much for the rest of the year. If you go through the mail, it's going to cost you this much. Every other plan is going to be more expensive, maybe $20 more expensive for the year, but every other plan is going to be more expensive. That's 8 minutes of your life. All right? And if you can remember this, when you get that far, if you then click on the name of the plan and go into the results, it'll tell you the premium, any deductible, phone number to call to enroll. It will let you know how much your medicines actually cost at that pharmacy, so you can go back and change. And then it will tell you in a bar graph, every month remaining of the year, what your total cost is going to be. This is premium, this is deductible, this is copay, da-da-da-da-da-da-da. So it really does break it down. It's very good. 8 minutes of your life. If after all that you say, well, thanks very much for that, but I don't take meds and I'm not going to have a drug plan. If someone says exactly that, I don't take any medicine, you can't make me pay $14 a month for a drug plan, yeah, totally right. But if you don't take a drug plan, Part D drug plan, when it's initially offered to you, and you do delay it down the road, the government's going to give you a penalty, which the poor drug plan that you enroll in is going to have to collect, and you've got that penalty for the rest of your life. It's not that large, but for every year it just adds up. So just remember that, okay? So that is your first option, be it good or bad. Let me get to the end. Be it good or bad, I got Medicare in all its glory. I've gone out and got a Part D drug plan. One of those, 26 in there. Next option. Still got Medicare, still paying for it. But now if you say, well, what about those deductibles? That hospital, that medical deductible. What about the 20%? Next option is a supplement, often referred to as a Medigap plan. Think of the name. It's supplementing Medicare. It's picking up the gaps in Medicare. So in this scenario, when I go to a doctor or a hospital, I'm presenting both cards, the Medicare and the supplement. The provider sends the bill to Medicare, deductible 80%. Medicare, not you, not the provider. Medicare forwards the balance to the supplement. And we're looking at the supplement to pay the balances for covered Medicare services. Hospital deductible, medical deductible, 20%. All right? Supplements pay balances for covered Medicare services. So before anyone deep dives and tries to say, well, does a supplement cover this service? Does this provider cover, is this provider covered by a supplement? As long as Medicare covers a service, as long as the provider accepts Medicare, supplements pay balances. Now, what does Medicare A and B not cover? Part D drugs. Part D drugs, yeah? Medicare A and B, you have to get that separate. So therefore, no supplement covers Part D drugs. You can underline that, Gerald said. All right, no supplement covers Part D. So I've got Medicare primary, supplements paying the balance, and then I go out and get a Part D drug plan if I need. Range of premiums. Again, I'm just giving you a range. Don't go away and say it's definitely this amount. I'm just giving you a range. Any plan in Massachusetts that offers a supplement offers 2 standardized supplements. The more affordable one does not cover the deductibles, it only covers the 20%. The more expensive one covers the deductibles and the 20%, effectively giving you 100% coverage, no deductibles, co-pays, or anything. The more affordable supplement is $100 on average a month. More expensive one is about $200 on average a month. And then to that, you go $14 to $127 for prescription drug plan. Third option from any company on the right-hand side is a Medicare Advantage plan, known as Part C. If you're doing the alphabet, we're up to C. Right, Medicare Advantage, still got Medicare, but now we've got to stop. We've got to look at Medicare a little bit differently. Now, what Medicare does is Medicare figures out what it expects to pay out in claims for people that live, every month for people that live in a given zip code or a given area. And then Medicare averages that out over the year. And Medicare says, tell you what, Medicare Advantage plan, we will pay you a percentage of that money every month, and you take over everything. Like with the Part D, Medicare pays the Part D. Now Medicare is paying the Advantage plan to take over everything. A couple of you put your hand up and said you got Medicare Part A. Okay. Do you know, well, now you know a bit more about what it covers, but you don't use it, do you? You don't show it to anyone. You don't even know what, right. So now imagine, those of you that have Part A, imagine that Medicare card now has Part B, but you treat it exactly the same. You use your regular insurance as if it never existed. All Medicare does is pay the Advantage plan. That's what I said. So therefore, the deductibles, the 20%, 80%, doesn't exist. If we're looking at an Advantage plan, we spend our time looking at the Advantage plan. What's the premium? What's the co-payment? How does it work? That's where we spend our time. So again, the Advantage plan is not paying the deductibles, it's not paying the 20%, because if anything is sent to Medicare by mistake, Medicare is going to reject it and say we're busy paying the Advantage plan. Now, Medicare is only going to pay one plan at a time. So Medicare says, if you want this Advantage plan, we will pay them. But if you want Part D, you can't go out and get one of these separate ones in. Medicare's not going to pay this lot and a separate Advantage plan. So Medicare says, quite wisely, if you want an Advantage plan and you want Part D prescriptions, find an Advantage plan that includes Part D. Don't get hung up on the fact that Part D has to be by itself. If I've got Medicare by itself or Medicare and a supplement, yeah, I'm getting a Part D plan by itself. If I'm looking at an Advantage plan, I'm going to find one that includes Part D. Medical and drugs together on one card. How novel. Now, an Advantage plan is going to be somewhat similar to what you've got right now when you're working. You've got one plastic card, as I say, for everything. You have a form of a network, HMO, PPO, private fee-for-service, whatever it is. You have co-payments, and you have your wellness benefits. All right? Now, when we look at Advantage plans, when you go out into the marketplace, you will find that companies that offer Advantage plans will give you a range of different levels. We have 5 different levels. All the 5 levels are exactly the same. There's, same doctors, same services, same formulary, etc., etc. There's 2 things that you change: premium and co-payment. So the less you pay us in premium every month, the higher the co-payment when you have a service. The more you pay us up front, the less. Okay, the point is, whatever you're basing your needs on, you're basing your needs on, your medical services, you're basing your needs on what you can afford to pay, or you're basing your needs on your comfort level, there's a plan that basically fits everyone. In this area, again, the most expensive is $199 a month. Medical, drugs, and all the rest, $199 a month. The most affordable, which has the highest co-payments, including medical, Part D drugs, has no premium. You get a statement every month that effectively says, please don't pay us. The money we are paid by Medicare, which is more than the $135 that you are paid, the money we are paid by Medicare based on Medicare's projected claims costs, allied to the way the co-payments are set up, drives the premium. You go from 0 up to $199, okay? The only, and one quick thing, there's one medical exclusion that would potentially stop someone joining an Advantage plan. That's if someone had end-stage renal disease, the last stages of kidney disease, because Medicare already has a program in place. Other than that, there's no health restriction that would stop someone enrolling. So that, from any company in any state, that's your showroom. You've just got to figure out. So the middle one says, if I want to go where I like, if I want the Boston hospitals and the Leahy and Lowell General, I want them all just in case. If I don't want a co-payment, I don't want a deductible, then I would go the middle. I go where I like, 100% coverage, very nice. There's your Ferrari. On the right-hand side, if I say, well, I want to put my medical and my drugs together, maybe I'm okay with my doctor referring me. And again, you're just looking at this year. Forget about 10 years down the road. I'm okay with my doctor overseeing my care, and I'll lower my premium by having a co-payment. Then I might go to the right-hand side.
Quick question.
I'll take questions now. Yes, sir.
So that means I can change the plan every year with no ill effect. Right?
Well, let me give it.
As I get older, I might want a different plan.
Oh yeah, in Massachusetts. Now, if we read this book, we will get a bit scared every now and then because it will show you in some states they can limit when you can enroll in a supplement or stop you at certain times and charge you more. In Massachusetts, it doesn't matter what your age is, you can change at the end of every year as you like. There's no penalty or anything like that. Other questions on this? Yes, miss.
So you get a bill or you have Social Security pay you for Part A and Part B. And then if you go to the Advantage, you get a bill from a healthcare provider like Tufts.
If you go to Advantage, if you go to a supplement or a Part D, it's all from private companies who are sending out their own bills.
So just on that same note, you're paying Medicare Part B, and those companies are getting a fee from Medicare, and you're paying the difference that they're charging for the service, right? For example,
Based on the different co-payments and
right.
yeah.
They're getting something. They're getting whatever the government gives them plus your what do you call it?
You're paying a co-payment, which kind of drives what the premium is going to be, if anything, yes. With the supplement, obviously, the supplement you're using the supplement to pay the balance. So Medicare's paying, supplement's paying a balance, they're not being funded by Medicare.
The Advantage can do it for free. It's not free, it's just less cost than the government gives.
Yeah, don't be thinking, I had someone say to me, well, I'm not taking that zero premium plan because if I call customer service, they're not going to give me the same care. Trust me, they are being paid quite nicely by Medicare. It's just that the co-payments are higher, and I bet you the co-payments are less than most of you are paying under your plans right now. Question?
What if you have a child under 26? Anything cover them?
If you have a child under 26, all right, it's getting a little bit out of my depth. Insofar as, all right, no, all right. So you go.
He's 66 and we have a 20-year-old.
Well, you go to the Commonwealth Connector and you look through there to see if someone's eligible for assistance, which could pay part of the premium. You can call up the individual plans directly. We've always had individual plans.
Right now, if you're...
Are they at college?
He's in college, yeah, but right now, they're covered till 26 on a private insurance.
Right, but so the other thing to do is to look at insurance offered by the college.
Right. Well, I mean, this is for the future because he's still working, but, you know.
Well, there's three options right there. He goes and gets a job and hopefully he has... Good luck, yes.
There's a nice tool for figuring out Part D by putting in your prescriptions and everything. I've seen it. But
Medicare.gov.
If you go to Advantage, you're kind of on your own to try and figure it out.
Well, all right. So that nice tool to figure out is Medicare.gov, isn't it? And you go there and it shows you most cost effective. So when you go to the results under Medicare.gov, I told you the top one is Medicare and prescription drug plans, which would account for this and this. The second one down is medical plans with prescription drugs.
So Medicare.gov has information on Advantage plans?
Yes. And let's understand, it's not taking into account medical co-payments or whether your doctor or not is in the plan. What it's doing is just letting you know, which plans cover your medicines and how much they are.
Okay.
And then
you have to evaluate the rest of it on your own.
Oh yeah, in that instance. And then the bottom result is medical plans that do not include prescription drugs. Because as I say, we've got 5 Advantage plans that include prescriptions. We've got 3 that don't. So if someone uses the VA or just plain don't want drug coverage, you accommodate them.
What about out-of-country coverage? Do any of the supplement plans cover out-of-country?
Your supplements, it varies with supplements, but supplements do cover you out of the country. It varies from plan to plan. And with Advantage plans, yes, generally there will be up to 6 months worth of maybe emergency and urgent care anywhere in the world. Question?
I got 2. One is more general. So if I go back to my private plans, the Advantage plan is like an HMO.
Can be.
And the other one is kind of like my PPO.
Oh, good. No, the middle one says, look, here's Medicare. Whatever they don't pay, as long as it's covered, whatever they don't pay, my supplement's going to pay. You walk away, you got no copay, you got no deductible, you got no in and out.
Okay. All right. My second question. I'm here because my mother's retiring in about a month or so in Pennsylvania. Her house is on the market and she's moving to Massachusetts.
Okay.
You said that these things change by state.
Oh, absolutely.
So she'll enroll in a Pennsylvania plan?
She'll be turning 65 while she's in Pennsylvania.
She's 75.
Does she have Medicare A and B?
She's got A.
So she's going to retire, apply for Part B, same forms I told you about.
Yep.
She gets something in Pennsylvania to tide her over, at which point she moves to Massachusetts. Whenever it is in the year, she is then free to change the option to something in Massachusetts. And again, you're more than welcome to call me at some point down the road. Yes, sir.
I kind of missed something here. When you get A, B, and D, what's Part C?
All right. So Part C is sorry, I should do this way. Part C is a Medicare Advantage plan, the plan on the right. Part C is a Medicare Advantage plan. A plan, so whenever you hear Medicare Advantage, just say to yourself, it is a plan that Medicare is paying to take over everything. Yes, go on.
Is the Medicare Advantage income contingent like the Medicare Part A?
No, but when we talk about income related, all right, so we got Part B is income related, Part D is also income related. So it's different figures for Part D, but you can also find, again, due to your income, you can have your Part D premium go up as well.
If at some point you decide you want to live 6 months in Florida and 6 months in Maine or something along those lines, you then just pick the cheapest state option and you declare residency in one of those states, and that's what drives it.
So whichever state, and this is the thing, for example, with an Advantage plan, the Advantage plan says you can visit anywhere in the world for up to 6 months. Your primary residence must be in Massachusetts. If you're more than 6 months somewhere else, maybe you're living there and visiting here. And so you would, if you are primarily living somewhere else and your Social Security, your address with Medicare and Social Security is that other state, that's what drives what your options are, and then you would look at this from the point of view of whatever state, Maine or Florida, that you're in. One more question. Yes, miss.
Scenario, a typical scenario of why you might choose the plan right instead of...
All right, so scenario, why we might go one way or the other. Middle column, if your specification, if your needs, if your wants, say, I want to be able to go anywhere. I want Lowell, I want Leahy, I want Boston hospitals, just in case. I don't want a co-payment. I don't want a deductible. I want 100% coverage. So if I want to go where I like and I don't want to pay any of these co-payments, I go to the middle. If on the other hand, on the right-hand side, I say to myself, I've got a doctor, and for the foreseeable future, I am quite happy with them overseeing my care. I'll let them refer me appropriately, and I'll, have a co-payment in order to reduce my premium, and I'll put my medical and my drugs together. Then I'm going to look at the Medicare Advantage. If I want to do 180 mile an hour, I look at Ferraris. If I want to do 80 miles to the gallon, I look at Priuses. Or you find a big cliff that you can drive your Prius over. One more question. Yes, sir.
So when I go to a hospital and I have to take that one shot, I'm there 151 days.
You're being specific now, aren't you?
Well, I thought that from 1 to 60, I don't do a copay at $2. 61 to 90, I pay $344 per day. That's not a copay, not deductible.
Are we talking about Medicare by itself?
I'm talking about Part A.
Right, Part A, with nothing else.
Right. So what would help me not pay, because after 151 days, I pay for everything in a hospital.
Right.
Does any of the gap?
So, if I take a supplement, let's say I take the more expensive supplement, all the way up to that 151 days, I'm not gonna say whether they are correct number of days or not. If I take the more expensive supplement, whatever that balance is, the initial deductible or anything after the 90th day or whatever, it's paying it. And then when Medicare's lifetime days, stop, then the supplement is picking up. Now, on the other hand, if I take the Advantage plan, is Medicare paying any of my hospital bill? No. It's down to whatever the whatever the Medicare Advantage plan says. All right? Last question.
Yeah, you said on the middle plan, the Medicare, you can go any hospital, any doctor.
Anyone that accepts Medicare.
For the Advantage plan, are you limited to a hospital you go to?
You've got to look at the specific Advantage plan. Generally, there would be a form of a network that you would use unless it's an emergency.
So that's one of the limitations of the Advantage plan.
Yeah, again, look, you don't, again, if you want to get a Prius to do 180 mile an hour, go find a cliff. So the point is this: if you are comfortable with your doctor overseeing your care and referring you to the specialists they use, then you kind of look at the Advantage plan. All right, so obviously we've taken more questions. Let's all go around my house. All right, 99. Now, so I'm going to give you one more slide, and the rest is just overview, which you're more than well. This slide here is the donut hole, this Part D prescription drugs. Doesn't matter whether you get Part D by itself in here, or Part D is included with a Medicare Advantage plan. We can all change premiums, deductibles, formulary. The one thing any Part D plan in this country must have is the gap. And if we go through a group retiree plan, if we go through the GIC or a municipality, we are not subject to the donut hole, the gap. But this is how it goes for everyone else. I tell you this, it affects very few people. Apologies ahead of time. So, you have, on most plans, a deductible. It might apply to all of your prescriptions. It might just apply to brand names. Some plans don't have a deductible, but generally expect a deductible to be satisfied before some or all of your prescriptions are covered. Then you go to the initial stage where you go into the pharmacy, paying a co-payment or using the mail order, paying a co-payment and leaving. Every month, per the Affordable Care Act, any plan that you take, it's going to send you like a 3-page statement which ultimately says, this is what you've paid out of your pocket so far. This is what the plan has paid so far. This is the cost of your medicine. So, if the cost of your medicine, not what you've paid. If the cost of your medicine reaches $3,820, again, this is all subject to change January the 1st. If the cost of your medicine reaches $3,820, next time you get a prescription filled in the same calendar year, you are in the gap. I just love saying, mind the gap. It's, you know. Anyway, sorry. Anyway, so if you reach that, you are now in the gap. Next time you get a prescription covered, you're going to pay a percentage. You're still covered, but you're paying a percentage, which is 37% for a for a generic, 25% for a brand name. You're still covered. You're now paying a percentage. The other side of the gap is when you, out of your pocket, have paid $5,100 again, same calendar year. That could be a combination of deductible, co-pays, and percentages. And again, it's all, you know, calculated for you, shown. And if you do reach that, then you have the catastrophic coverage for the rest of the year. So just remember, it's the cost of the medicine that goes here. It's what you paid out of your pocket that goes there. All right? The rest of the presentation is basically summarizing supplements. You can enroll in a supplement any month of the year. Advantage plans. There's your initial 7 months around your birthday. There's past 65, you can enroll 3 months before. There are exceptions to enrolling in a plan. If you move from one area to another, you can change. Everyone at the end of every year individually has from October the 15th to December the 7th to make a change for January the 1st. There is no penalty from a plan or you know, the only restriction is end-stage renal disease again. Various resources. I'm the one at the bottom. Text me, call me if you need me. Questions? There cannot be any more questions. No more questions. All right, that's it. Thank you. Cheers. Cheers. Thank you all very much, and hopefully you've all learned something. Cheers.